Yeah, today we will learn about the pleural and peritoneal reflections, especially the circulatory system is concerned. And what is that particular system is the pleural and the peritoneal reflections are essential components of the thoracic and abdominal cavities, and they play a very key role in especially the abdominal cavity and its reflexes. So they play a very key role, and they play the different type of the role in respiration, circulation, and overall health in case of the cattle. And it is formed by the pleural reflections are formed by the pleura, which are having the visceral and the parietal layers, and to create a pleural recesses like the costodiaphragmatic recesses. So this pleura in cattle provide us additional protection and associated with major thoracic vessels like the caudal vena cava and also the aorta. Then peritoneal reflections are formed by the peritoneum, visceral and parietal layers and create structures like the mesentery, momentum and also different type of the ligaments. And these support and protect abdominal organs and vascular structures, and they have extensive momentum in cattle which help in containing the especially the infections. And the integration of circulatory system pleural reflections maintain optimal in the positioning up of the heart and great vessels, and also ensure the efficient oxygenation and the systemic circulation. The peritoneal reflections anchor organs, preventing vascular compromise. And the pleural reflex and anchor organs are also there. So, this is about the cattle, etc., in general, but we have got the some details about the pleura and what is it is, etc. So pleura is a double layered serous membrane lining the thorax and enveloping the lungs. The pleural cavity on each side is almost completely filled by a lung, leaving the cavity as a potential containing thin film of fluids. So pleura is in two layers. That's the number one is the visceral pleura and also the parietal pleura. So the next thing is the parietal pleura. It lines the thoracic cavity on each side of the mediastinum, and visceral pleura covers the outer surface of the lung and is continuous at hilum with the peritoneal pleura. So unlike the pleural cavity, etc., the visceral pleura dips into the lung fissures. Therefore, the fissures, the visceral pleura adjacent holes lie in contact with each other. The pleural cavity on each side is almost completely filled by a lung, leaving the cavity as a potential space containing the thin film. So this is the human lung, and the pleura is the outer coat, and it is also followed by the external coat, the pleural cavity, and also the visceral pleura is containing. Then the parts of the pleura are costal pleura, mediastinal pleura, and also the diaphragmatic pleura. So apart from this one, the another part is cervical pleura. Then also, as per the parts and other thing, this type of the pleura has been associated, especially the boundaries of the pleura. For example, this is the pleura. So the upper one to the lower nine in case of human beings, which is enclosed in the thoracic cavity, is also called as the different types of the pleura. and the surface projections of the flora. So the even number like 2 to 4 centimeters above the medial third of the surface. So this is the human lung, and the pleural passes the sternocervical joint, reaching the midline at the level of the cartilage. So the pleura continues till especially till sixth costal vertebrae, and pleura on the both side pass around the chest wall, and this is about the human. And certain pulmonary ligaments are there, and it is an ill chosen name, has nothing to do with the lung since it is a pleura. So pulmonary ligament is not a ligament, and its correct sense of the meaning, it's a double fold pleura that is hanging over the lungs root as empty fold, and it provides a dead space into which the lung descends with descent of the diaphragm, and pulmonary vein can the uh, expand during the periods of increased venom return from the exercise. So the pleural reflections are sternal pleural reflection is where the costal pleura is continuous with mediastinal pleura, and the previously the mentioned lines pleural reflections are called as the pleural reflection. The lines, these are all the lines, they are called as the pleural reflection. So here you can see the sternal pleural reflection where the costal pleura is continuous with that of the mediastinal pleura. Then the costal pleura reflections is where the costal pleura continuous with diaphragmatic pleura. Reflection means the demarcation line, nothing more than that. So the vertebral reflection lies posteriorly along with the lateral side of the bodies of the thoracic membrane, and also mediastinal diaphragmatic reflections are also present. Then the lung marking corresponds to those pleura above the two ribs higher in the lower part of the thorax. Thus, lung reaches the level of the cartilage, and the different cartilages are also lung reaches the level of 10th rib, especially in case of human beings. And during the full inspiration, the lung expands until uh, uh, the pleural cavity. But during quiet inspiration, there are three sites where lung does not fully occupy the pleural cavities. So these are called as the pleural recesses, and the sites where parietal pleura comes into contact with pleura are called as the pleural recesses. These are all the sites where parietal pleura comes into contact with parietal pleura. Then the pleural recesses are only occupied by the lung tissue, and during full respiration, they are the right and left costodiagnostic costodiagnostic ones, especially the pleural reflections. So costodiaphragmatic recess means this is the one. It is located inferior margin of the pleura. So this also exists in case of the cattle. Then radiologists call this region as costophrenic angle. This angle where in which the costo end of the diaphragm rests. So whenever they take the X-ray, excess fluid in the pleural cavity will cause an opacity, which alters the angle also. So the costomediatinal recesses are also present in case of the human lungs. Of course, these are not so well demarcated and very well good pictures are not usually affected. So, just compare with that of the uh, human beings with that of the animals, and same terminology it also hold good. The nerve supply to the pleura is as regarded as part of the lung, the parietal pleura as chest wall. Then nerve supply is by autonomic nerves are always supplied, and partially it is the somatic visceral reflex. The parietal pleura is part of the chest wall that is supplied by somatic nerves, and also the phrenic nerves are concerned. And apart from this one, the collateral nerve branches are also going to stimulate. So the parietal pleura is thus sensitive to pain, etc., because it is served by the phrenic nerve. So, referred pleural pain is common, referred as symptoms arising from regions supplied by the some intercostal nerves supply the pleura. Thus, the pain is referred to the chest and abdominal walls that are both supplied by the intercostal nerves. So, irritation to the mediastinal or central part of the diaphragmatic pleura supplied by the phrenic nerve is referred to as tip of the shoulder. So these are all the structures. And blood supply, of course, the visceral pleura derives arterial supply from the bronchial arteries that supply the lungs. And here you can see that the blue lines are the veins and the red one are the supply with that of the arteries. And bronchial arteries are uh, bronchioles of the thoracic aorta, and blood supply is by the thoracic aorta, and the pleural cavity is a potential space containing thin film of the fluids. The pressure inside the lung is more or less atmospheric, and pneumothorax is always the accumulation of air in case of the lungs. And tension pneumothorax, sometimes air enters into the pleural cavity during the inspiration, and pneumonia may also happen. Pleural effusion is also known as the hydrothorax. It is the presence of excess fluid in the pleural cavity, and the fluid tends to gravitate toward the costo-mediastinal recess. Thus, it obliterates, and many times this has to be removed as a part of the pleural effusion hydrothoracic method. That's about the pleural effusions method, and we can say that this also relates to that of the cattle or other domestic animal. And thanks a lot.